Assalamualaikum warahmatullahi wabarakatuh. Good morning, good afternoon, and good evening for see this video, guys. And hello, sir. My name is Frida Feridia. You can call me Frida. I'm from Indramayu College of Food Science. Now, I would like to explain about definition of heart attack and sample case of heart attack. Before I explain about definition of heart attack and sample case of heart attack, do you know about heart attack? Yes, okay, it's a good answer, but let's see explanation for me about definition of heart attack and sample case of heart attack. Definition of heart attack occurs because blockages of blood flow to the heart muscle. The main cause of this condition is coronary heart disease, which is the blockages of blood vessels that supply blood to the heart, coronary arteries, caused by cholesterol deposit that form plaque in the walls and blood vessel. Next, I want to know about sample case of heart attack. We can take a case that recently happened to the voice of famous Indonesian singer, husband of Bunga Citra Lestari, namely Ashraf. His death suddenly of a heart attack at the ages of 41 years old.
Hello, my name is Indah Niatisa'ah. You can call me in. I'm from Heart Attack Group. I will describe type or classification of heart attack. Do you know how many type or classification of heart attack? There are 5 type or classification of heart attack, namely type 1, spontaneous heart attack, occurs due to tearing of coronary artery plaque. Type 2, secondary heart attack ischemia due to increased oxygen demand or reduced oxygen supply. And type 3, unexpected heart attack including sudden death. Type 4 divided into 2, namely type 4A regarding coronary angioplasty and type 4B due to stent thrombosis, and type 5 heart attack in connection with CIBG.
Hello mister, my name is Ika Rika, you can call me Ika. I want to explain about the symptoms of heart attacks. Next, I will to explain about the complication of heart attacks. A. The symptoms of heart attack. There are several symptoms that can be felt be severe of a heart attack, including 1. Chest pain, 2. Heavy breathing, 3. Dizziness, 4. Restless, 5. Cold sweat. However, there are several of heart attacks who do not experience symptoms and directly experience a sudden heart attack. D. The complication of heart attacks. The main complication that cause death and several other accompanying diseases such as arrhythmia, heart failure, and heart attack.
Hello, my name is Imam Maulana Yusuf. You can call me Imam. I intend to give explanation about prevention of heart attack. Heart attack can be prevented by adopting a healthy lifestyle. Ways that can be done include: Number 1. Increase consumption of unsaturated fats such as fish and high fiber foods such as brown rice. Number 2. Reducing consumption of sugar and salt. Number 3. Dealing with diabetes and hypertension. Number 4. Stop smoking. Number 5. Exercise regular. Number 6. Don't abuse drugs. Number 7. Manage stress.
Hello mister, my name is Sipta Ip and you can call me Ip. I want you to explain about handling of heart attack. The first, handling of heart attack. RGP or basic life support understanding BID is first aid that it's done to victim of cardiac arrest or stopping breath before being treated by medical personnel or hospital. BID stage. Number 1, safety. And number 2, check response. Number 3, call help. Bring at the automated external defibrillator AED is a device to teach the basic rescue skill of AED and the correct defibrillation procedure. And next breathing, and next RGP 30 message, 2 med breathing, and the last spontaneous response. Next, look at chest movement. If there is a meaning position, if there is no other give association of any breath 10 until 12 minutes. Number 2, danger. When we find the victim, make sure the first, safe self or helper, and the second, safe victim, and the third, safe environment. Number 3, respond. Awareness check, and the first, call the victim. Should wake up, sir, or wake up, mom, and open your eyes. Open your eyes, mom, or sir. And the next, cough, shoulder, stimulate point. And next, if there is no response, shout for help. And next, wait the victim, shout for help. And next, stay with the victim, use the call phone to call for help, turn on the speak, wait your finger length. Number 4, circulation. Perform chest compression with the following provisions. And number 1, adjust the position of victim. The victim is on his back on flat surface. Number 2, helper place on the right side of the victim. Number 3, place the heel of your palm in the middle of your chest in your palms. Take it with your fingerling. And number 4, compensate between chest compression and breathing support. And number 5, perform compression 5 until 6 centimeter deep into the chest. And number 6, speed of 2000 minutes. And number 7, done for 5 cycles. The next, number 5, breathing. Give breath for 2 with tidal volume with technique. The first, mouth to mouth, and the second, mouth to breath device. Mouth with a bare tissue or a cloth. Number 3, mouth to nose, mouth into nose. And number 4, mouth to stomach. Mouth with holes made to insert breathing aid made by combat medical personnel. And number 5, valve mask. 4 is evaluation. Evaluation is done every 2 minutes. Number 4, breathing. Anesthesia 2 until 3 compression ventilation. And number 2, if breathing min and plus and ventilation 10 minutes. And number 3, F breathing plus and plus give a response position. And when will the heart message be stopped? Number 1, patient have respond, and number 2, come a more expert team or advice, and number 3, relief of fatigue, and number 4, there are clear signs of death, and number 5, do not resuscitate or DNR family refuse resuscitation.
Hello, my name is Maya Sinta. You can call me Maya. I want to explain about the treatment of heart attack and action that need to be done to prevent future heart damage. The first, treatment heart attack with medicine, namely antiplatelet drugs such as aspirin and chlorprodigal. 2. Blood vessels dilation drugs such as nitroglycerin. 3. Painkillers such as morphine. 4. Destructive blood clots such as streptokinase. 5. Anticoagulant drugs such as enoxaparin. 6. Cholesterol medication such as absorption. 7. A type of ACE inhibitor such as ramipril. 8. Beta blocker hypertension medication such as bisoprol. And the second, treatment heart attack with surgery, namely installation of heart ring of coronary angioplasty and bypass heart surgery or coronary artery bypass graft. Okay, thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.